Cost sharing occurs when you pay for part of your health care out of your pocket. Generally, the higher your cost sharing, the lower your premium, so cost sharing saves you money each month when you pay your premium, but costs you more when you need services. Cost sharing can be required in the forms of deductibles, coinsurance, and copayments. An annual deductible is an amount you pay each plan year before your health coverage begins to pay benefits. Many, though not all, plan years begin on January 1st. If you have a single plan and a $2,000 deductible, you pay $2,000 each plan year before you receive any benefits. Your plan may have deductibles that apply to specific services, like prescription drugs. Your plan may also have different deductibles depending on whether you use network or out-of-network providers. Some services may not be subject to deductibles. Often, preventive care is covered at 100% with no deductible. Your plan may have an individual deductible and a family deductible. When the family meets the family deductible, your plan begins to pay benefits for all family members. Family deductibles can be aggregate or stacked. With an aggregate family deductible, all family members' deductible expenses count toward the same family deductible. Your family must meet the entire family deductible before anyone gets benefits. With a stacked family deductible, an individual may meet an individual deductible and start receiving benefits. The rest of the family continues to pay deductibles until they meet their own individual deductibles or they meet the family deductible. Let's compare the two. The Wilson family has a plan with a $2,000 individual deductible and a $4,000 family deductible. Bob, the father, has a procedure that costs $2,000. Then, Sam and Josie each have an office visit that costs $85. With a stacked family deductible, Bob meets his deductible and begins receiving benefits, while the visits for Sam and Josie go toward their deductibles and toward the family deductible. With an aggregate deductible, Bob's expenses do not meet the $4,000 deductible, so the family does not receive reimbursement for the office visits. Occasionally, a plan may require 2 or 3 family members to meet their individual deductibles before the family deductible is satisfied. After you meet your individual deductible, or the family meets the family deductible, you may share in the costs of your care through coinsurance or copayments. Coinsurance is a percentage of the cost of care. For example, you may pay 20% of the cost of your care while your health plan picks up the other 80%. Your plan may also require copayments. They are specific dollar amounts that you pay when you need services. For example, you may pay $5 each time you fill a generic prescription. Your plan likely has an out-of-pocket limit. When your expenses reach this limit, you do not have to pay cost sharing. Your plan will begin to pick up 100% of the Blue Cross and Blue Shield of Vermont allowed amount for the services you need. If you are using a network provider, you will pay nothing. You may have a family out-of-pocket limit as well. If you currently have coverage and need to know your cost-sharing amounts, log on to the Blue Cross and Blue Shield of Vermont Member Resource Center and check your outline of coverage. If you were shopping for coverage, consult the summary of benefits and coverage that links from our Plan Finder and our Plan Match tools. Blue Cross and Blue Shield of Vermont, we'll see you through.